Good day, this is Professor McClammy talking today about medication errors. So adverse drug events are reported to and researched by the Institute of Medicine. So these include medication errors and adverse drug reactions. So many medication errors do cause or coincide with adverse drug events. So in 2006, the IOM study estimated that about 1.5 million people were affected by medication errors that resulted into harm of those patients. So medication errors are preventable. They're the common cause of adverse healthcare outcomes, and the most common drugs involved with medication errors are central nervous system drugs, anticoagulants, and chemotherapeutic drugs. And more potential to harm, they're considered high alert medications. So SALADS is Sandolik lookalike, and LASA is lookalike Sandolik drugs. Issues contributing to errors are procuring, prescribing, transcribing, dispensing, administering, and monitoring. So know what all of those definitions are, what they mean, and which part of the process they're involved in. Issues contributing to errors: organizational, educational, sociologic, and use of abbreviations. Preventing medication errors, multiple system checks and balances should be implemented to prevent a lot of these errors. Prescribers must write legible or enter electronically, and then authoritative resources such as pharmacists and other personnel to help out. Preventing medication errors, doing an assessment to patient identification. Do not administer if you did not drop or prepare yourself. Minimize verbal or telephone orders and list indications next to each other in order. Never assume anything about items not specified in the drug order. Do not hesitate to question the medication order for any reason, and do not try to decipher illegible orders. You always want to contact the prescriber to clarify. Preventing medication errors, never use a trailing zero. So you don't want to put 1.0 milligrams, you just want to put 1 milligrams, but you always want to do a leading zero. So 0.25 milligrams. The 6 rights of medication administration: the right drug, right dose, right time, right route patient, right documentation. So say that 10 times, say it another 10 times, and memorize that. You will need to know that information. Another right is a constant system analysis. So you always want to double check and just make sure that you have everything right before you give the medication to the patient. Focus on patient safety. 6 elements of a drug order: make sure that it has the correct patient name, date order is written, name of the medication, dosage, route to be given, and the signature of the prescriber. So with this particular order, looks like all the components are there. With the second one, Tylenol 2 tablets, PO every 4 hours, is not correct because you don't know the milligrams or strength of the Tylenol of the 2 tablets. Medication reconciliation happens anytime a patient is transferred from one floor to another, a new patient in an office. You want to make sure that the information is correct and up to date. Let's see here. You should always do it at admission, anytime there's a status change, and then upon discharge.